Greetings, everyone. I hope you're doing well. I am Dr. Jeffrey Sterling. I am the Surgeon General for Phi Alpha Fraternity Incorporated, and very pleased to be here with you on behalf of our General President, Brother Lucian Metellus. Tonight is a very special night for so many different reasons. For those of you that are familiar with St. Jude, you know how special of an organization it is. And I actually to prove that point, I just want to just mention that in the work that I do across the world, St. Jude is actually a common topic of discussion. I recall fondly, even in Johannesburg, work that I was trying to do or that I did with the Nelson Mandela Children's Hospital, which aspires to be the St. Jude of the African continent, just discussing the methodology and the charitable contributions and the entirety in which St. Jude makes an impact around the world. That is truly an impact that is felt, and we're so pleased to be able to bring the originator of that, St. Jude's, here today. And we're also pleased to be able to discuss how Alpha Phi Alpha Strategic Partnership will advance its efforts while supporting our own efforts. Before I move into the formal program, I would actually be remiss if I didn't also welcome back, who's part of our panel, the founding conceptual father and president that implemented the Surgeon General Initiative. And I'm honored that he brought me on board 6 years ago with the deputies to serve in my current capacity for Alpha Phi Alpha. You'll be hearing from Brother Dr. Willis Lonzer, again, our immediate past president. So I will say my welcome to you now. Let's get right to it because this is a really exciting topic. We have a fantastic panel, and I don't want to have you miss any of what we're going to be discussing. The moderator for tonight is Alpha Phi Alpha's Deputy Surgeon General for Dental Health, and he's been that now for 6 years. He's one of our originals, obviously. He received his DMD degree from the University of Kentucky in 1977, joining the U.S. Navy following dental school, where he served 30 years on active duty, completing a fellowship in endodontics. He served as following that retirement, he served as an associate professor and chair of the endodontics department at Howard University for 12 years, retiring in 2019. He has a ton of awards, and I never will go past an introduction of him without pointing out just how fantastic his career has been. On the military side, his awards include the Legion of Merit, the Defense Meritorious Service Medal, the Navy Meritorious Service Medal, the Navy Commendation Medal, the Global War on Terrorism Medal, the Humanitarian Medal, the Expeditionary Medal, the Navy Defense Medal, and the Sea Service Deployment Ribbon. Inside of Alpha Phi Alpha, I need say no more other than he has been Alpha Man of the Year in 4 different chapters, and for the Eastern region of Alpha Phi Alpha, earning that award as the Alpha Man of Merit. Brother Smith is again the inaugural Deputy Surgeon General for Dental Health, and he's going to introduce the rest of our panel and steer us through our conversation tonight. Thank you for all that you do. Thank you for all that you are, and welcome, and let's have a great show.
Thank you very much, Brother Dr. Sterling. It is good to be with you all. I want to say welcome. Welcome to our panelists and welcome to our guests in the audience out there who are tuning in to hear this very exciting, enthusiastic presentation on St. Jude. So I am, as Dr. Sterling said, Dr. Langston Smith, Deputy Surgeon General for Dental Health. And I welcome you on behalf of our General President, Brother Lucian J. Metellus Jr., our Board of Directors, our Surgeon General, Brother Sterling, and the Deputy Surgeons General of Alpha Phi Alpha Fraternity. On their behalf, I welcome you. And we're very glad and very happy that you are taking this time tonight to join us for this discussion. Tonight, we have modified our trajectory somewhat, and we're going to have a conversation with an organization that is doing exemplary work in the field of healthcare, especially for children, and has a giant in research and healthcare. And this organization is helping to save lives of children and is a giant in sickle cell anemia research and treatment. With us tonight, we have Mr. Quentin Hendre, the Principal Advisor for Development of the American Lebanese Syrian Association of Charities, St. Jude Children's Hospital and Research. Past General President, Brother Dr. Willis L. Lonzer, our St. Jude patient representatives, Elani and her mother, Danita. Darnita, I'm sorry. So I want to thank you for joining us tonight, and we look forward to hearing the St. Jude story and from you. Now, you might ask, how is Phi Alpha Fraternity Incorporated involved with St. Jude? Well, approximately 6 years ago, Brother Lonzer approached the then Health Affairs Committee to develop a partnership with St. Jude. That morphed into the Surgeon Journal Initiative, assuming that responsibility. And we're working on this partnership because of the work and the contributions that you do and how you impact the lives of so many, not just in the United States and across the world, but across the world. And we felt this is something that we need to be a part of and need to be involved in. We began our discussions, and subsequently the fraternity donated $100,000 to St. Jude, and we are currently working to finalize this partnership agreement that we have with St. Jude. At the forefront of all of this is the fact that Sickle Cell Anemia research program at St. Jude was initiated by an Alpha brother, Brother Rudolph Jackson. And you will learn more about that in the program as Quentin and his team presents. That in addition to the fact that in 2010, nearly 100,000 African Americans had sickle cell anemia disease. 1 in 13 African Americans carry the trait. 1 in 365 African American babies are born with the disease. And 1 in 16,300 Hispanics will have the disease. So this is why St. Jude is doing such a tremendous job, okay? And so our program tonight will be led by Mr. Hendre, who will introduce us to the St. Jude, and this will be followed by a patient's view of St. Jude and the treatment and care that they have received, and then comments from Past General President, Brother Lonzer. So, Mr. Hendre, I turn it all over to you.
Thank you for that, Dr. Smith. Making sure that everyone can see my screen. We are good to go. But good evening to the men of Phi Alpha Fraternity Incorporated, distinguished guests and viewers. I am Quentin, Hendre, an advisor for ALSAC St. Jude Children's Research Hospital, where we are finding cures and saving children, not only within the United States, but around the world. I bring greetings and gratitude from Memphis, Tennessee, the home of St. Jude, where I've served the mission for nearly 9 years. Thank you to General President Matillis, Dr. Smith, Dr. Lonzer, Dr. Sterling, and all other dignitaries for allowing us to join you all this evening. I am accompanied by St. Jude patient Elani and her mother, Darnita, who you will hear from shortly. Alpha has a deep history, as Dr. Smith mentioned, in the support of the St. Jude mission, and I'm excited to share a little bit more about that. The mission of St. Jude started with a prayer by our founder, Danny Thomas, who was a struggling entertainer trying to find his way in life, and made a promise to St. Jude Thaddeus, the patron saint of hopeless causes, that if he helped him find his way in life, he would build a shrine. That shrine is St. Jude Children's Research Hospital. And before St. Jude opened, Danny Thomas and a group of his friends canvassed the country for 5 years, raising money to open St. Jude, where they formed an organization named ALSAC, which stands for the American Lebanese Syrian Associated Charities. We are strictly the fundraising and awareness organization for St. Jude. Whenever you see a commercial, a billboard, you may walk into a store and the cashier asks you, do you want to make a donation to St. Jude? Or you may have had a chance to attend an event. Our team is responsible. Then you have St. Jude, the world-renowned children's hospital and research institution, where patients and their families, along with doctors, nurses, scientists, and all support staff who bring our mission to life with treatment, care, and research. 2 separate entities that serve one mission. Our mission is unique, and many consider us to be the heartbeat of pediatric healthcare and research. Yes, it is true. Families never receive a bill for treatment, travel, housing, or food. Yes, when our hospital doors opened in 1962, the overall childhood cancer survival rate was 20%, but today it is more than 82%. 85% of funding comes from generous donors and partners like the men of Phi Alpha Fraternity Incorporated. It is also important to note that we freely share all of our discoveries and research with the world. We are far from stingy. Not only do we treat for childhood cancer, but our dedication and progress towards our efforts with sickle cell disease is a priority for us as well. In fact, that is what helps fuels me to serve the mission. I do not have sickle cell disease, but I do carry the sickle cell trait. Growing up, my mom would always say, ask if your partner has sickle cell trait. And at the time, I did not understand the depths of why she would say that. And it wasn't until I joined the mission in 2017 that I began to learn more about the disease and how we have been intentional from the beginning in the progress towards treatment and cures for the disease. St. Jude has one of the largest sickle cell disease programs in the United States. The first grant the hospital ever received was for sickle cell disease. In 1983, St. Jude patient Kimberlyn, who had both sickle cell disease and acute myeloid leukemia, underwent a bone marrow transplant, which originally prepared to treat her cancer. The procedure also cured her sickle cell disease, and she became the first person in the world to be cured of sickle cell disease by way of bone marrow transplant. We later published results showing that hydroxyurea, a medication to help reduce the frequency of a painful crisis and the need for blood transfusions, is safe for infants as young as 9 months. And in our latest progress, St. Jude scientists found that patients with sickle cell disease who receive gene therapy experience a return to normal blood flow in the brain, which will help prevent strokes in the long term. Now, there have been many people to help drive our efforts with sickle cell disease over the course of our history. And one in particular is Dr. Rudolph Jackson, a pediatric surgeon and early faculty member of St. Jude, who formed and led our sickle cell program for several years. Oh, by the way, he was a proud member of Phi Alpha Fraternity Incorporated. Again, the brothers of Phi Alpha have a deep history of impact on the St. Jude mission. Now, I will stop talking and pass it along to two people who have been directly impacted by the mission. Please give a warm welcome and applause to St. Jude patient Elani and her mother, Darnita, who will share their journey. Thank you, Elani and Darnita, for taking the time to be with us. I will pass it to you.
Thank you all so much for having us. First, I must say it is an honor because my father was a member of Phi Alpha Fraternity Incorporated. He pledged at UT Chattanooga, and he was also a nurse. So this is like a full circle moment for me. But I thank you for allowing us to be here. I knew when I was pregnant that I had a 25% chance of having a child with sickle cell because her father and I both possessed the trait. But the first 10 years of her life, I navigated without St. Jude. So that meant doing my own research, finding my own doctors that could help us. And because sickle cell does not have any outward physical signs, sometimes the disease isn't taken as seriously as it should be. That being said, because there are no regular childhood illnesses when you have sickle cell, a fever of just 101 was an automatic admission to the hospital for us. So we spent many, many months in the hospital. Every 3 months, like clockwork, she was in the hospital because she had a fever, or I was checking her spleen every day to see if it was enlarged. Between the ages of 5 and 7 years old, I'm checking for signs of a stroke, which is quite typical for someone that has sickle cell. I watch for the yellowing of the eyes or jaundice. That was our sign that a pain crisis was coming. And when a pain crisis comes, it's debilitating. For Elani, it was her crisis or in her legs. So she would not be able to walk. She would not be able to stand on her own. So those are the things that people don't talk about when they talk about sickle cell. We are blessed that we were able to get on hydroxyurea diarrhea early on, and it did make a huge difference in her life. We've done so many things to make sure that she was taken care of, but because we did not have St. Jude, we didn't even know that we could have St. Jude in our life. It was a struggle. She lived in a bubble because we were always trying to protect her from the elements. You can't be too hot. You can't be too cold. You can't fly. The altitude, everything that everyone else takes for granted, we were consciously watching every single day to make sure that she was not only healthy, but was able to have a piece of childhood. And Elani can take it over from when she was able to join St. Jude.
Yeah, so I became a patient at St. Jude when I was 10 years old after we moved closer to the Memphis area, and it was completely life-changing. I grew up, as my mom mentioned, in and out of the hospital, so I was used to the typical hospital environment, but even then, St. Jude was just completely different. I remember my first day, I met so many people, and they became people that I know and love, part of my care team. And they all made sure that I felt like I was more than comfortable, but almost as if I was like at home. So throughout my treatment, my team always encouraged me to live a life outside of my illness. Like my mom mentioned, I had a lot of no's growing up. So it was, no, you can't play outside in the snow. It's too cold and it'll trigger a crisis. No, you can't go to dance rehearsal. You're going to tire yourself out and end up sick for the rest of the week. So instead of telling me what I couldn't do, St. Jude found ways to make almost anything accessible. My mom always encouraged me to advocate for myself, but St. Jude really strengthened my ability to do so. And soon I became known for being busy. My nurses always knew that I was looking forward to something like performing in a musical at my community theater or leading clubs and service organizations in high school or competing at choir competitions with my school choirs. But no matter what, I was always involved in something. And if I wasn't, or felt as if I couldn't, St. Jude always reminded me that I could, that there was always a way to make these things happen. And like my mom mentioned, I did get on hydroxyurea around the earlier points of when the drug became more accessible for younger children. But even then, because it was such a new drug and because it really hadn't been tested with youth so much, my dose wasn't as personalized as it could have been. And St. Jude took the time to customize the perfect dose for me. And now, because of that, I'm able to do so much more. And that's why I'm where I am today. So, growing up with a chronic illness looks different for everyone, but there's always the point where you transition from pediatric care to adult care. And it's really daunting and really scary, but St. Jude really held our hands throughout the whole process and made sure that I was with a team that I was comfortable with when I decided where I was going to go to college. So they never limited my schooling to just the Memphis area. They really encouraged me to go far and do whatever it is that I wanted to do. So right now, I'm more than 600 miles away from home in Charlotte, North Carolina, and I'm in pastry school, and I work as a baker, and I also have a food blog, and yeah, I'm doing everything I want to do. So my major is food and beverage entrepreneurship, and later on, as I get older and learn more over the years, I want to eventually own my own bakery. And I've had so many experiences in college now. I've worked at the Masters golf tournament. I've worked at all these different clubs and organizations, just huge, huge events that I never thought I could do. I never thought I could work in a kitchen in such a crazy active environment, but because of St. Jude, I'm able to pursue my dream.
Yes, it's the holistic approach that St. Jude takes that makes the difference. It's not just treating the medical side of her, it's treating her as a whole person. So, if you have a little anxiety about moving away or your test coming up, they have someone that she can talk to. They other people in her life that help her with schooling, like she said. She's able to advocate for herself, and sometimes she wasn't able to go to class. So we were able to navigate how do we allow her to keep up with her schoolwork, but still be able to take care of her health. And when St. Jude stepped in, it allowed me to step back, and I became a mother and not a caregiver, not a nurse, not somebody that has to know everything about what's going on, keeping care of charts and everything else. So that stress that is taken away from parents when they're allowed to just be there with their child, and the money that is received, they put it to great use. The research, we've participated in several studies that we hope to help someone else not have to go through some of the things that she has had to go through, or to have a life as great as hers has been. Because early on, we never thought she would go away to school. We never thought she would be able to do so many things that she's been able to accomplish. So thank you all for listening to our story. Quentin, we'll give it back to you, and we're here to answer whatever questions you all may have for us.
Thank you, Elani and Darnita. I never get tired of or take hearing your story from granted. And, I hope the viewers really can feel and understand the impact that St. Jude is making, not only on Elani and Darnita, but patients around the world. And, I know we can be, a bit of aggressive in our ask and really pushing to, raise as much funds as we possibly can, but that's to attribute to impacts and to make impact like St. Jude patient Elani. So thank you for sharing your story. Dr. Lonzer, I will pass it to you.
Well, it is just amazing to hear the story of Elani and Mrs. Bailey and her journey with sickle cell disease. Let me say that I'm more familiar with it personally, and I'll speak to that more at the end. But as a scientist, as a biomedical person that's involved in pharmaceutical research and global research and development professionally, it was empowering to learn more and more about the St. Jude story. I remember even as a child being a fan of Danny Thomas, but then realizing the philanthropic heart that this actor, this Lebanese man, and I didn't know his ethnic origin at the time, but to learn more about him and this incredible vision that he had, and to be able to see the power of not only in sickle cell disease, but also in cancer and other rare diseases that impact young children. It was amazing to see what it was done. And Elani, your story just makes me smile. And I'll keep my comments brief, as I know that it's always about brevity when we're having an opportunity to speak. But I'll say that sickle cell disease has impacted me personally. Growing up in Richmond, Virginia, the screening methodologies were not as effective and widespread. And I was a sickle cell trait carrier unknowingly, and married a sickle cell trait carrier. And one of my 3 children, that 25% chance that Ms. Bailey absolutely spoke accurately about, each time that you consider having children, my daughter is a sickle cell disease patient. However, like Elani, she triumphed and is now a first-year law student and on her way to becoming an attorney and an advocate in many ways. She's a Spelman College alumna, and it took a program, although she was not a benefactor directly of St. Jude, and it would have been really a conflict of interest if it was, and I'm glad it was not, because I did not want to personally benefit, but I saw the importance of the work of Dr. Rudolph Jackson. Even our discovery of the WIC program that Dr. Jackson was the champion of, that helps infant babies have a nutritious diet. The impact of that, and he was an alpha man and a scientist, a physician, is just humbling to be in the wake of his work and to see the great work that the scientists and physicians at St. Jude are doing. And I congratulate Elani. I congratulate her mom and her family for standing with her, encouraging her. And of course, Mr. Hendre, you go as an unsung hero, because the work you do behind the scenes, people don't get to see. But we realize that it takes advocacy and champions to move a program forward, and Phi Alpha and is a part of the catalyst of that. And I want to thank personally General President Metellus, my successor as General President of this august fraternity, the oldest fraternity, college Greek letter fraternity, intercollegiate fraternity for men of African descent in the world. It took his vision to couple with my vision to continue that beacon of light in medicine and research, and to be an advocate for a program as noble as the St. Jude's program. So congratulations, Mrs. Bailey. Congratulations, Elani, on your new foraging career. And I hope I can taste your pastries one day, even though it might be a small part, because I have to watch my diet so I can stay healthy and stick around. So I'll close my remarks, and thank you, Dr. Smith, for inviting me, Brother Dr. Smith, and Mr. Hendre, for your continued work. And thank you to Mrs. Bailey and to Elani for sharing your story with the world. It's so important that that story is told, and that young people, even when they have a debilitating chronic disease, are able to pursue their dreams. Congratulations.
Right. Thank you. Thank you so much, Brother Lonzer. And I want to thank Elani and Mrs. Bailey for your comments. They were so far-reaching and so touching. But before we do anything else, I would like to say to our audience out there, if you have any questions that you would like to submit, please put them in the comment box, and we will try to get to those questions in the next few minutes that we have. Okay, so thank you. I will now go back and say, what you have shared with us tonight tells the story of St. Jude. And you may see the ads on television. You say, well, you know, this and that. But from what you have shown tonight and what you have shared with us gives us something that we can now tie to those ads and say, yes, St. Jude is doing what is great out there, and they're impacting not just here, but the world. And it gives us a better perspective and a better understanding of St. Jude and the work that they do. And I just want to congratulate you on your how you fought this battle and how you've overcome this battle. Okay, and to see you, Elani, where you are today. And yes, I'm going to be like Dr. Willis, Lonzer here. I want to be able to share some of those pastries that you, I may be able to eat, you know, grab a little bit more than he does. But anyway, Mr. Hendre, thank you for helping us put this together and sharing with us and bringing the team together. And I think I would be remiss if I did not mention the former mayor of Memphis, Brother A.C. Wharton, who really worked with us early on, really 6 years ago, in developing this agreement and this relationship, or this partnership. And so I just want to thank him for the support and for his involvement in bringing this to the table of Phi Alpha Fraternity. Okay, so I don't see any questions in the comments section. And I think Brother Sterling went back to work. So with that, I would just like to thank the audience out there for joining us tonight. And I hope that you have picked up some tidbits that you can share with your family, your friends, and your network, and let them know that St. Jude is for real. It is a real deal. And what we have shown tonight are the benefits of that real deal. Elani, thank you. Danita, thank you. Quentin, thank you very, very much. This has been an enlightening conversation, and I'm so proud to have been able to help put this together. So with that, I would like to say good night to all, and thanks for joining us. Have a great evening and week. Thank you.